unstable pelvis does not mean something is out of alignment and out of place. It just means that they are not working together. The different causes of unstable pelvis that you need to be aware of are beyond something you did. It's more likely something you didn't do. So there are things like your lifestyle, your habits and behavior, previous injuries, and how you work things out, how you work out in general, how you stand, how you sit, how you walk around. All of those are things that, when done wrong, can contribute to unstable pelvis with its many manifestations and signs and symptoms. So before we begin, I want to remind you that your pelvis is a foundation to the structure above. If the foundation is not strong, the foundation above is not going to be strong. It is so important for this to be stable that you have muscles on the inside that are to work with the outside environment to stabilize the pelvis. When you sit for an extended length of time, for example, or you stand up and you find yourself clenching your butt, or you hold your breath, or you suck your tummy in, or you have lower back issues, sacroiliac joint issues, things like that. These are just examples, some of the examples of pelvic floor dysfunction. We can see that stability is not there, in other words. These muscles on the inside now have to make up for what's not happening. The pelvis itself is made out of 3 bones that form 2 joints in the back and 1 joint in the front. Then you have your spine that's connected to the top and your lower extremities connected to the bottom. When the pelvis is unstable, that instability can be from itself, from injuries you've done, from accidents you've had, from lifestyle choices that you've made, to issues that are related to the spine, that now that connection is compromised. And so pelvis is either going into anterior or posterior pelvic tilt, or your lower extremities and the hip mobility is a functionality that is not proper and it's negatively impacting your pelvic stability. Bottom line is that your pelvis and what's connected to it are not coordinating their movement and it doesn't get a chance to stabilize. So the unstable pelvis is the reason why you're having your symptoms. How do we go about fixing it? Is this a stretching? Does that mean your body part is weak and you need to work it out? Does that mean you're stuck with it? Should you get Botox injections? Should you get nerve blocks? What is the story? The answer is none of the things I just mentioned are going to stabilize the area. And frankly, the extreme measures we take to address these difficult cases is just mind boggling. For instance, when it comes to Botox injection, which happens a lot more often than you realize, the attempt is to try to relax a muscle that is too tight and it's putting a pressure on a specific structure that is now causing an issue. The only problem here is the opposite of tension is not paralysis, it's relaxation. So when you paralyze a muscle, while that muscle is paralyzed, what's doing its job? That's the question we want to find out. What we want to address is the stability or lack of, and the way we do that is through developmental exercises. Now, just a side note, what resides in this hole here are bladder, prostate, uterus, ovaries, intestines. You've got arteries, veins, and nerves. You have muscles, joints, and ligaments. All of those structures, you can have manifestations of symptoms there, more in one than the other, or any variations of or combination of. So we can't go after the nerve to try to block it. We can't go after the muscle to try to Botox it. We can't give medication to numb it. We can't sit on a donut, expect the donut cushion, expect that it's going to make it go away. What we need to do is take away the reason why these muscles are compressing the structures inside, which means bring stability back. I use developmental exercises because that's how you learned how to stabilize your body parts, so much so that at one point you became a running toddler where you could barely hold your head up. You could not do anything without help, and then you became an independent toddler. No gyms, no bands, no weights, no guidance, right? And yet we did an awesome job of balancing ourselves. So if we repeat that, and frankly, what you and I and every walking human being on the planet Earth has done the same exact thing. That means you're hardwired here, your body parts know exactly what they are to do. So if we learn what they look like, what they feel like, what right looks like, what your version is, we can match these and stabilize the pelvis. I treat pelvic floor dysfunction, joint instability in my practice, doing just that. And most importantly, teach my patients and my clients how that's done so they learn the material, they move on. Kind of like once you learn how to drive, you can drive until the last breath or until they take away your license, but you get whichever one comes first. So you get the point here, right? Hope this makes sense. If it does, please comment below, say it makes sense. If you have any questions, if you have any suggestions for more videos, search my YouTube channel. I have thousands of videos there. If it's not there, tell me and I'll make a video. But do know that the answer to your problem lies within you. You just need to learn and then move on. Hope this helps. Thanks for